Good morning. Today we're going to be talking about diphtheria, which has been a lot in the news. Good morning, Dr. Mutiu and Dr. Alero Roberts. It's a pleasure to have you both with us again on the program. Thank you for coming. Dr. Mutiu, can I start off with you? Can you tell us what is diphtheria and why are people worried about it now?
Thank you very much. Diphtheria is a bacterial infection caused by Corynebacterium diphtheria. It's normally a childhood disease that affects children mainly. And one of the features will include fever, sore throats, the occasional membrane-like covering of the breathing apparatus for the child. So the child may not be able to breathe. And the child may even have a swollen neck, what we call bull's neck. Now, normally for diphtheria, it is preventable with vaccine. Once the children take vaccine at ages 4 weeks, 10, and 14. But nowadays, we are seeing an outbreak in Nigeria in the past almost 6 to 8 months. And the age group is something that has been worrisome between 2 and 10. So the question is, why are we having a resurgence? Why are we having something that we expected is supposed to have been removed completely? So normally, diphtheria is caused by Corynebacterium diphtheria. It's one of the organisms that is vaccine preventable. Now, we're looking at our dynamics. Is it because of the overpopulation that we're having? Or is it because of undernutrition? Or is it because some people did not take vaccine when they were supposed to take? Or looking at the age range, those age 2, then definitely during COVID outbreak in 2020, was it that they missed the vaccination that they were supposed to take? But the challenge with diphtheria is that the mild case is just respiratory system, anything that has to do with breathing. But it may progress to involve the heart, in which the heart now becomes bigger, and that heart can stop at any time. It may even involve other parts of the body, even the brain. So diphtheria is a dangerous illness, but it is vaccine preventable. Thank you.
Wow. So, but I mean, is that the cause? Because you suggested it, but we haven't actually proved it. Because we do know that because of the COVID, a lot of people didn't go out. Everybody was on isolation. They didn't go and get their vaccines, and is that the reason for it? Dr. Roberts, you're a public health physician. Can you tell us what are your views? What is the cause of this outbreak? Why is it so alarming?
Okay, it is alarming because, as Dr. Mutiu says, it affects the children, it affects their breathing, and it's even more alarming because it is one of the vaccine-preventable diseases for which Nigeria has had a very, very, very robust immunization schedule. If the child is fully immunized at 6 weeks, 10 weeks, 14 weeks, we really should not be seeing diphtheria making a resurgence like this. However, as you quite rightly pointed out, Dr. Ajayi, the truth of the matter is that since the pandemic, we've had major gaps in the implementation of our immunization program. Our routine immunization programs were completely sort of broken, as it were, partly due to the pandemic, also partly due to the ongoing internal displacement of people from the Northeast and from the Northwest. So we are having these gaps in the immunization schedule, and children are falling into these gaps and are now at risk of these vaccine-preventable diseases, of which diphtheria is one. You will recall that this is the second outbreak of a vaccine-preventable disease that we are having.
Now, that's very worrying. But is it just worrying for children? Is there any effect on adults?
Sadly, no. What we have seen in our facility, in fact, the 2 cases we lost were in their teens. So Dr. Mutiu, it doesn't just stop at age 10 either. One of the cases that we lost was a 14-year-old. So you can imagine how distressing that must be for the family. And we do know that adults are also at risk. One hopes that because a lot of our young adults would have been immunized. You know, when I say our young adults, people born after, say, in the mid-80s and early 90s and whatnot, who are now adults and are now having their own children. We may not see a lot of cases in that age, in those people, but we do know that there are some young adults that are at risk of getting diphtheria.
So, Dr. Mutiu, this is indeed alarming. So I just want to get it clear. Is it that once you've had your proper vaccines, you are now immune? Or is it that you can still get it if there's an outbreak like there is now?
Thank you very much. You see, after getting vaccinated, the body is expected to respond and produce antibodies as a baby. But over time, the antibodies will wane. The level of antibodies will wane. So the WHO has an advice in which you take booster dose, even as a teenager. So, but the question now is, the initial vaccine that was taken, the body was able to respond adequately to produce protective level of immunity against diphtheria. If the body was able to produce enough immunity, protection against diphtheria, then we don't expect to see these cases. So it's either some people did not even take vaccine at all, they were never vaccinated, or their body for one or the other did not produce the expected level of protection. So that's why WHO advocated for another booster doses when as a teenager, so that the person is better protected from diphtheria infection.
Is there an ongoing revaccination program in Nigeria at the moment that people should be aware of?
For now, we are just starting, because with the response that we have ongoing, what we've done is to identify those ones that have been infected, then the contacts. So we look at their vaccination history. In Nigeria, what we have is diphtheria and pertussis together. So normally, pregnant women are given as part of the protection that are given to them. And now the NCDC is already advocating for it to be given to those who are at risk, the healthcare workers, then the contacts of the cases that we have, so that at least we are able to boost the level of immunity. But we don't have a program now for massive immunization of everybody. We've not reached that level.
So, Dr. Mutiu, talking about the vaccinations, are you saying that we don't have the vaccines that we need to protect our teenagers, that what we have are only the vaccines for children? If we don't have them, when are we expecting to get them? So how soon will we be able to be sure that we can get our children, all of them, from both the babies to the teenagers and even the young adults, protected?
Thank you very much, ma'am. Concerning the vaccine for the children, it's still available. It's still the pentavalent vaccine that will be given to them. But for the teenagers, because we don't have this kind of outbreak before, what has been available has been for pregnant women, tetanus tozoid and diphtheria tozoid combined together. So the advocacy now between NCDC and the Nigeria MPHCDA, that is the Primary Healthcare Development Agency, is for the purpose. So the vaccine, the diphtheria and tetanus tozoid vaccine that's available for pregnant women, so that we're able to use it even for our teenagers at this particular time. So with that, we'll be covered.
So for people who are listening now, are we telling them, take your children now to the to the health centers? Are we telling them to take their children and their teenagers now to the health centers to get it done? What is our advice? Because people are listening. We've got millions of people out there listening to this recording. They want to ask. They want to protect their children. Dr. Alero just said some teenagers have died. Anybody with teenagers who's listening to this is thinking, you know what? I need to protect my children or my grandchildren. So what can they do?
For now, I believe more of what we are going to do is more of personal hygiene. we've not gotten to that level in which we will do mass vaccination of everybody. The primary healthcare facility will be overwhelmed. So the most important thing is personal hygiene, covering the cough. What we have been doing during COVID, even wearing a face mask, all those ones, they are protective enough. When we look at how one contract diphtheria, it's via droplets. The droplet that comes from the nose face or from the mouth, that is basically the main ways in which one can get diphtheria infection. So with the use of face masks and proper washing of hands, we'll be protected. We don't even need to recur to the issue of vaccination because we've not reached that level. And in the past few days, we've not had any new cases, even in Lagos State. Though our hands are on deck and we're training more people in the issue of identification, disease surveillance, nursing officers, even those within the community are doing a lot of work trying to trace so that we are able to make sure we do not have an outbreak on our hands. So for now, people should stay calm, but personal hygiene is very, very essential.
Wow. Now, this is something that is so difficult. A lot of people have just abandoned the paraphernalia and the paranoia that came with COVID. And so what you're saying is we should return to that state? Is that what you're saying?
You see, the ideal thing, ma'am, is for every case of respiratory tract infection, if I know I have respiratory tract infection, the ideal thing for me to do is to use the face mask. This has been in practice even in Asian countries, most countries. It's only in Africa that we have not been doing it. So it's high time we move to that level in which I'm responsible for my own health as well as the health of people around me. So basic things like face mask to protect others around me. So we should go back to that.
We've actually had some confusion. People have, sent messages in wanting clarification. The question asked is this a condition that can move from adults to children or children to adults? Are we experiencing a resurgence of a COVID-like phenomenon that we should be careful about? How should it be managed from an individual perspective?
Thank you very much. It's a communicable disease, so definitely household contacts, irrespective of the age, can be infected. Even healthcare workers too can get infected. So that is why for every case, that's why the index of suspicion should be very high now. For every case of sore throat, fever, red eye, you take it with a pinch of salt.
Can you take us through the symptoms, please? Can you take us through the symptoms really through, so we can know, people listening can know the symptoms, the signs and symptoms of what they should be looking out for? How does it start?
Okay, the child will present with fever, running nose, then there will be red eyes, there will be a sore throat. For children, they may not be able to say they have sore throat, but there will be difficulty in breathing. They may not be able to tolerate fits. Then with time, if you examine the mouth, you may be able to see these white patches at the back of their throat. And for some, the neck may even be swollen. And that is when it is limited to the respiratory tract. But if it involves other organs, then it may be much more complicated than that. But
now the issue for that we have.
The disease will normally start. The fever. I beg your pardon.
Please carry on.
The classic symptoms will be fever, red eye, sore throat, or difficulty in feeding for babies or children. Then the neck will be swollen, what we call goose neck. Those are the classical symptoms we see.
Okay, now does it devolve into cough? The reason why I'm saying this is that when I traveled, I came back recently. I had a sore throat. I had a running nose. I didn't have much fever, but I had difficulty in breathing, and I was not feeling very well. And I just assumed it was some COVID-like or symptom process, and I self-isolated. But the issue being that this is happening to adults, and there seems to be a flu going around. People have said it's COVID-like, it's COVID, it's not COVID. What is it? And how can people deal with it? Because you're talking about children, but we do know, as you just said, that people in a household with children can be affected. And particularly if you're traveling and you're passing through a place and you're sitting in a place where children are having signs and symptoms, and you just might catch it there. So what is it? Do you understand what I'm saying? So the confusion for us and for a lot of people. Sorry, Alero, carry on.
I said this is the important thing for the public, because at the end of the day, we don't expect every person, every member of the public to be a doctor or a nurse to be able to make a diagnosis. So if you have any form of illness, any form of unwellness, particularly if it involves the nose, the runny nose, the eyes, the respiratory system, the nasopharyngeal area, this head and neck area, the important thing is to get it checked out. Now, the symptoms you described, chances were probably a flu or a COVID-like symptom, but you're very right, because the problem is that diphtheria presents in pretty much the same way. The only difference is that for diphtheria, particularly in children, there's also this very high fever, a really dramatically high fever, which we were not really seeing with the COVID and the COVID-like symptoms. However, having said that, we do not expect a member of the public to be able to make a diagnosis and say, oh, this is COVID, I can do this, and this is not. You really do need to, if you are not feeling well, that's the time to go and get to the hospital and get a trained healthcare worker to take a look at you. But like Dr. Mutiu had said in the earlier segment of the program, we are very strongly advising personal hygiene. Let's get back to the hand washing. Let's get back to the hand sanitizer. If you are in a public place, wear a face mask. This thing, even the COVID has not gone away, and people shouldn't forget that for susceptible people, COVID still kills. COVID still kills. The last thing you want is any kind of illness that gives you any kind of respiratory distress. So Dr. Mutiu said it, and it bears repetition over and over and over again. We need to take collective responsibility for our health and the health of those around us. If you are going into a crowded place, you traveling, unfortunately, whether by bus, by rail, by air, or public transport, public buses, you are required to go spend some time in a crowded place where all sorts of people are there. Just wear a mask. It's a very simple message, because you don't want to be getting, and then we have, what do we call it? Stories that touch the heart, because it was this or because it was that. No, the members of the public do not need to be able to make a diagnosis. They just need to protect themselves and prevent these things from spreading.
But now we have this issue. But people are even wearing masks, and I tell you, there are few people I've seen wearing masks. Well, say, why are you wearing a mask? What's the matter with you? Take it off now. What is it? You actually have pressure from other people telling you to take your mask off. I mean, it's like, why are you wearing a mask? And so people who are even trying to do the right thing are not encouraged to do that. In fact, the opposite is happening. They're being ridiculed.
I know, but the point of the matter is that we were always going to be, you are ridiculed for taking any kind of health promotive or health prevention measure. Why must you not eat too much? Why must you go out and exercise? Why must you do any other health promoting activity? People will always ridicule that, but at the end of the day, you matter to yourself and to your family. The last time I was seen wearing a mask in public and everybody was like, I just said, I have a cough. Oh, okay, all right. They back up, because suddenly nobody wants anybody coughing in and around them. It's suddenly socially unacceptable to be coughing in public and coughing without covering your nose and mouth. So if you wear a mask and say, oh, I'm protecting you from me, people then allow you to say, but you see, at the end of the day, we must take that collective responsibility. Dr. Mutiu, you are going to add something.
Yes, thank you very much. No, the issue of stigmatization now will come in that, okay, we are wearing face masks, but as you have rightly said, you have to just tell them, I'm protecting everybody. You protect yourself, you protect the community. And for household contact, if you feel that, okay, anybody is having sore throat, fever, red eye, and the neck is now swollen, the best thing is to try and see a physician. Just don't manage it at home and say, oh, it's something that will go easily, especially at this period in which we have so many respiratory illness flying about. So you may not really know what we are dealing with. But one classical sign that we always see with diphtheria is this white patches at the back of the throat. So with that one, we can easily say, oh, this is diphtheria. But the most important thing is that we should not wait until we get to that place. We should seek help once we know such a thing is happening to any of our children, especially at this particular time. And for the healthcare workers, they should still practice standard precaution for every patient they are seeing. Some of the healthcare workers have been exposed, and we have to give them prophylaxis, which would not have been needed if they have taken proper measures. Standard precautions, we should not dump it at any given time. Whether COVID has gone or not, standard precaution is standard precaution and should always be adhered to. Thank you.
No, thank you very much. And I think one of the things I also, latched on to was what Dr. Alero said about how this period is not just diphtheria that's a problem, but we have other, unfortunately, I was going to ask about polio and other things, but I hear that time is almost up. We have, received notification that we just have 2 minutes at the end of the show. But I don't know if there's anything you want to make in terms of parallels to other conditions that are predominant in the community that there's a resurgence of because of the COVID and lack of vaccination. So I don't know if you have any last words for our listeners, Dr. Mutiu.
The last word is for us to take care of our health, be very observant with a high index of suspicion. Don't let us take everything that, oh, it's just the flu that is just passing around. Then let us be proactive. For children, we must make sure they get immunized. For the pregnant women, they must get their vaccine as at when due. And for all of us, we should take care of our health. Personal hygiene is very, very crucial at this particular time. Hand washing, hand sanitizer, those ones are very, very crucial. And balanced diet too. It's very, very important. Thank you.
I think Dr. Mutiu has said it very well. I think Dr. Mutiu has said it very well and has said it all. Please, we must take responsibility for our health. Everything he has said, I totally concur. Personal hygiene, very important. Do not assume. Get anything that you're worried about, get it checked out by a trained healthcare professional.
Thank you for watching. Please like, share, and subscribe for new video updates.